Myself, Dr. Kumar, pediatric pulmonologist, and I run my own clinic, that is Child and Chest Healthcare, Sahibabad, Ghaziabad, Delhi NCR, and presently I am affiliated to Santosh Medical College Hospital, Ghaziabad, Delhi NCR, and I am head of the pediatric pulmonology unit, and I am in charge of pediatric intensive care unit of Santosh Medical College Hospital, Ghaziabad, Delhi NCR. Asthma is the most common respiratory disorders in children, and the most difficulty arises when parents are not able to accept the diagnosis of asthma in children. They are scared of the diagnosis of asthma in children, and if one will not accept the diagnosis, how can they accept the treatment? So second difficulty arises during the treatment. Mainstay treatment of asthma is inhalational corticosteroids, and inhalational routes are better than the oral route. So it is very difficult to convince the parents to use the inhalational route of therapy, because they think it as a taboo, and we have to decide the best treatment for the children suffering from asthma, because it is a debilitating disease when it is not diagnosed at the earliest and treated properly, and there is so many school absenteeism, there is burden to the child, to the society, and to the family. So there are so many drug delivery systems for inhalational corticosteroid therapy, and this is the main treatment. So the metered dose inhaler should be used, and it should not be used alone. It should be used with devices appropriate for the age of the child. So if the child is below 5 years of age, the metered dose inhaler should be used with a spacer and mask. If it is more than 5 years of age, no mask should be used, because if you use mask, you increase the dead space. So we are compelled to use mask with a spacer, that is holding chamber below 5 years, because the child below 5 years cannot inhale properly and cannot coordinate properly. But if you use metered dose inhaler without spacers, then the drug will deposited maximally on the throat and minimally to the airway where it is required, that is the target site. So parents should be convinced not to use metered dose inhaler alone, because the one thing is they are not accepting to use this metered dose inhaler, and once they accept it, they want to use alone without the device. So they should be convinced that if you use device, there is no coordination is required, number one, and the drug delivered to the target site, that is airways, is maximum, and drug deposited over the throat is minimum. And it is necessary, because if the drugs will be deposited over the throats, it will cause some adverse effects, whereas it will be less advantageous for the child. So these are the obstacles. We should overcome these obstacles to treat asthmatic children in a better way. Number one, accepting the diagnosis of asthma, we should convince the parents your child is suffering from asthma. Second, we should convince them the mainstay treatment is inhalational corticosteroid, that is low dose corticosteroids. And third, it should be used with metered dose inhaler along with a spacer if the child is above 5 years of age, and spacers with mask if the child is below 5 years of age. Even in cases of above 5 years of age, some children are not able to inhale properly through the spacers, so they can be offered mask. Thank you very much.